Hello, I'm Dr. Rob Lindsay, and today we're going to be starting a series on autoimmune success secrets. We are part of Vallejo Health and Wellness Center here. Myself, along with Dr. Nate Samuelson and Dr. Aaron Moreland, practice functional medicine. We are chiropractors, but we're trained in functional medicine, functional neurology, and we are neurometabolic practitioners, which means we look at the nervous system, we look at the organ function. We may even look at, we do often look at blood chemistry to try to find out the root, the underlying causes of autoimmune diseases. And we've got a series here now of success secrets, things that you must know in order to get better from an autoimmune condition. So today we're going to start with success secret number 1, and then we'll have subsequent videos with success secret number 2, so on. We'll have up to 20 or more of these autoimmune success secrets in this series. So I hope that you can get a lot out of this, and thank you for listening and watching. Okay, so the first thing, the first success treatment is to know this, is that lab ranges are extremely broad, and this can pose a problem. If you ever wondered, why do you still have these symptoms when your lab tests are normal? See, why do you still have, say, for example, thyroid symptoms, or when your TSH is between 0.35 to 5.0, which is the normal lab range? That's the range that shows up on your labs, and you fall within that range, and the doctor says, well, you're normal. Most likely, though, your MD has only ordered one thyroid test in this case, which is TSH, thyroid stimulating hormone. Now, maybe he's ordered a couple more, okay? But from your MD's perspective, if your TSH level is within that very, very wide lab range of 0.35 to 5.0, you're normal. There's nothing wrong with you. But, and this is a huge but, the optimal level, or what we call functional level, for TSH is 1.8 to 3.0. So you could still be normal in the medical doctor's eyes, but abnormal in the functional or optimal range. It's only when that range is above 5.0 that your medical doctor will put you on a thyroid hormone such as Synthroid or levothyroxine. But, as I mentioned, in a medical doctor's eyes, if your thyroid TSH is within 0.35 to 5.0, you are normal. There's nothing wrong with you, or it's all in your head. You don't need medication because you don't have a thyroid problem. Even though you still may have all these thyroid symptoms like extreme fatigue, your hair is falling out, you're losing the outer third of your eyebrows, you're gaining weight even though you're on a low-calorie diet and you're exercising like crazy, they are still going to say you're normal. Well, you and I both know that you're not normal. If you were, you would not be suffering from these symptoms. You could be within the normal TSH range, normal again, right, of 0.35 to 5.0, but still be outside the optimal range of 1.8 to 3.0. Your TSH level could be at 4.2, and that's why you're having the problems. It's outside the optimal or functional range. The same is true for any other blood test, for thyroid, really for any of the blood tests. Looking at diabetes, they'll look at your blood glucose, and if you're within 65 to 100, they're going to say you're fine. But optimal is 85 to 100. Okay? But in some of these other thyroid tests, such as total T4, free thyroxine index, free T3, and the 4 other tests that need to be run on your thyroid to get the exact cause of your problem. Now, one more thing, they typically don't run all those tests, and that leaves you in the dark. Okay, so this is the end of our autoimmune success secret number 1. Remember, the lab ranges that they're comparing you to are extremely broad. We need to start looking at it from a more narrow perspective. So if you're sick and tired of being sick and tired, call our office at 952-949-0676, schedule an appointment, and we can talk to you more about this. Thank you. Look forward to seeing you at the next success secret.